Hi, I'm Ian from Reinge Education.
Hi, I'm Daniel from Rocktape UK.
And in this video, we're taking a look at plantar fasciitis and what Rocktape can do to help with that condition.
We're going to be looking at how Rocktape can be used to treat those conditions and what it does at a physiological level and how it can also improve proprioception to help manage and treat this common condition.
This video will sit alongside our bite-sized CPD videos, which will give you much more detail about plantar fasciitis and the treatment options, and you can find those by following the links or going to reingeeducation.co.uk.
Let's get started.
Okay, so in our bite-sized plantar fasciitis CPD, we talked about fasciitis in the bottom of the foot, creating pain, but also weakness. So is there a taping technique to help that, Dan?
Yes, there is, and I can show you a technique, Ian, to do for the foot, which is easy to do but can be effective at reducing pain for people.
Great.
So the first thing we need to do is make sure the foot is clean and dry, and we can do that simply with some baby wipes, alcohol wipes, or alcohol gel and couch roll, for example, things that you typically have in your clinic. So a nice clean dry foot is a good base to start the taping with.
And presumably that's what, to help the tape stick?
Yeah, even the best tapes won't stick to a sweaty skin or oily skin.
Okay, I see you've got different coloured tapes here. Is there any reason why they're different coloured?
No, the colours don't make a difference to the properties of the tape. Some patients, of course, may have a preference for colours, or they may really dislike a colour. So colours do matter to the patient, but we don't really go into colour psychology on our course, but we are aware there is such a thing as that. So therefore the patient could choose. You could choose the colour in, but I'm going to use two different colours just to make it clearer on the video as to what I'm doing with the taping. So
brilliant, fantastic.
I guess we'll start with some red tape here. And I'll make a start.
So you're pre-stretching the foot there by the looks of it?
Yep, I'm pre-stretching the foot here. I'm stretching the, extending through the toe there to get a stretch through the intrinsic muscles of the foot, and dorsiflexing the ankle to get a stretch through the Achilles, which has that continuity with the plantar fascia tissue.
Yeah, what would happen if you didn't pre-stretch it?
It might be okay if you didn't pre-stretch it, but you're kind of missing a trick, because by pre-stretching the tape, you also proprioceptively activate the tissues as they feel that stretch reflex. And also you make sure that the tape moves with the individual's movement. If you were to tape into a neutral position or even a shortened position, the tape may start to run out of stretch once the foot goes into the stretch position, and then you have the issue of the tape starting to pull on the skin as it's not stretchy enough. So stretch them, stretch the tissues, stretch whatever joint you're working with, and then you start the taping.
Brilliant. So much more there than just putting tape on. There are reasons for everything. Let's have a look at how it goes.
Okay, so I've measured the tape here. I'm starting from the ball of the foot underneath the big toe there, and then I'm coming round and over the Achilles tendon.
Presumably that is a decent pair of scissors you got there, or can I use any scissors I like?
You might get away with using any scissors you like, but you do need a decent pair of scissors. And a decent pair of scissors essentially is obviously a pair that are sharp, but also a pair that have got some kind of Teflon coating or coating on the blade. That stops the glue building up on the blade, and once the glue builds up on the blade, the scissors start to become rather useless. And you can clean them, but then it's just a hassle. So a decent pair of scissors does make a big difference.
Great. And I noticed you took the corners off. Why did you do that?
Yes, I did that for two key reasons. The first one is by cutting the edges off, you reduce the chance of the tape catching and peeling off, as those edges or stress risers can cause the tape to start to peel. And once an edge starts to come off, then the tape starts to come off in total. So that's the first reason. The other reason is that anybody that does taping or has been on a course always rounds the edges of the tape. It's like one of the golden rules. So if you don't do it, no matter how good a therapist you are, it kind of isn't a good sign that you have, that you know what you're doing essentially. So it's important.
Look professional.
So always round your edges. It's a golden rule. Now, we tear the backing paper. The tape will stretch, the backing paper will tear, and that allows us to pull the backing paper out of the way without touching the glue side of the tape. And that's another golden rule, Ian, is you don't need to be your fingers and thumbs on the glue. You can just go and peel the backing paper away, and then be quite precise about where you put the tape down. And what I'm doing here is I'm being precise. I'm making sure that the tape sits underneath the toe and is not starting in the middle of the ball of the foot, because if you can imagine, that's a key weight bearing area. And if you had somebody running around and the edge of the tape was on the ball of the foot, it wouldn't take long before that started to ride up and peel off.
And are you stretching the tape as you put it on?
Yep, you can stretch the tape, and throughout the techniques we're going to look at in the videos we're doing today, we'll have different amounts of stretch. We don't need to be too precise about whether it's 50, 60 or 70% because you can never really determine how much that is. But we're going to have a moderate degree of stretch there as the tape comes over the arch of the foot, and then again maybe a little less stretch as we come up over the Achilles. But the most important thing, Ian, is no stretch at the end. The beginning and end of the tape, the anchor points, they always have no stretch. And that's important because as you stick tape in different places and as you stretch tape more or less, if you don't have good anchor points, the tape's more likely to convolute and peel off.
And what's the reason for that stretch you've put in the middle? What's that creating?
Well, there's no exacting evidence out there, but essentially if you add more stretch, it's thought that you're going to get more sensory feedback and more proprioceptive input from the area if you stretch the tape. So that's why in some cases and in some areas we add a bit of extra tape stretch. But one thing you need to be careful with though on balance is if you overstretch the tape over joints that move a lot, like the shoulder or the knee for example, then you can actually risk causing skin irritation because the tape is too tight, it pulls against the skin, and with lots of movement and tight tape you've got a recipe for skin irritation. So we have stretched the tape a bit here, but we also need to be careful not to overstretch the tape in many other key areas.
Yeah, good. So proprioception was mentioned there. Is that a primary function of the tape?
Absolutely. Yeah, proprioception is one of the wonderful things you can do with the tapes for various different ailments around the body, various different pain syndromes and movement disorders. And the input from the tape gives the individual more awareness of that area and of that movement, and you can then harness that to educate a better movement pattern and harness that to improve their rehabilitation.
Great. So that would sit really well with some of the strengthening that we've looked at in the bite-sized plantar CPD video. And is this providing support as we would with a traditional taping pattern?
No, the tape's elastic, so it can't give a physical support in the same way that rigid tapes can, but it gives that proprioceptive input to potentially make some changes to movement, and also the low sensory input from the tape can help to reduce pain as well, just via that non-noxious input as well.
Yeah,
one thing I've been doing, Ian, whilst you've been talking, is incessantly rubbing the tape. And I should mention that as much as our model Rose is probably enjoying that, it is an important thing to do because it sticks the tape down onto the skin. And if you don't do it, the tape often is just floating on the skin and it will soon peel off.
Is that it? Is that the pattern completed?
No.
Oh.
As we spoke about earlier, I'm going to take a different colour so the viewers can see the technique more clearly. And I'm going to measure up there from the outer border of the foot in the non-weight bearing region on the lateral foot there, through the arch of the foot and then over the medial malleolus, and if I get it right it'll come up roughly in line with the existing piece of tape on the heel.
Are there specific reasons for those particular locations that they see with it peeling off, or is that again to do with the proprioception?
Yeah, it's both. It's both. Ian. So the first piece of tape there, if I can show that, and this should be again in the other video that you can see on the screen here, which shows a close-up, but I'm on the lateral border of the foot there, which is a non-weight bearing area, therefore it's less likely to rub off.
Yeah.
Now, as we spoke again, we get a little bit more proprioceptive feedback typically if we add a bit of stretch. So we're going to add a bit of stretch as we come through the arch of the foot there, and then reduce that to paper off tension and no stretch on the end. So we've got that good anchor point at the end. Stick the tape down, rub the tape to make sure it's all secure onto the skin. And there we have the tape, starting and finishing in non-weight bearing areas. It's less likely to rub off, but taking advantage of firstly the continuity between the Achilles and the plantar fascia, and then also taking advantage of having a proprioceptive influence through the arch of the foot as well. And that may fit in with some strengthening elements that you've planned for this condition.
Yeah, that's really good, because one of the things that we talk about in the plantar fasciitis video is how when the arch of the foot becomes weak, and we're looking at the proprioception there to help with that, that people can take over by trying to stabilise through the heel with the Achilles. So we can see Achilles tendonitis coming in and soreness. And hopefully Dan will have a taping technique for that as well.
Yep, absolutely. We'll have a look at that next.
Okay, so Dan's going to show us the taping for the Achilles and the calf, and hopefully this will help with stopping that becoming a problem when you have plantar fasciitis and you're really overworking those muscles and threatening to create Achilles tendonitis and pain. over to you, Dan.
All right, so this is a common technique that's used a lot by people with this Achilles issue, and of course most commonly runners as well. So I'm going to start the taping just off the weight-bearing area of the heel and run the tape over the Achilles and then up to around the mid-calf region. And the tape can vary in length, so it can be as short as just enough to come out the back of a typical shoe heel cup and cover the Achilles, or you can run right up to the back of the knee, but not over the knee because that would be uncomfortable as the tape sticks and unsticks to the sensitive skin on the back of the knee there. So we're just going to do it mid-range here.
Yeah. Is there any reason why you'd run all the way up the leg?
You're going to cover more of the posterior calf region, you're going to cover over the gastrocs more. So if you want to get more sensory input, more proprioceptive input, and potentially more stimulatory input through the plantar flexor muscles here, then it would make more sense to come over the back of the calf as well.
The more tape, more proprioception.
Tear the backing paper, not the tape. The tape will stretch, the backing paper will tear. We can peel the backing paper out of the way and apply the tape over the weight-bearing, just off the weight-bearing area of the heel. We need to make sure that's quite precise, because if you stick it in the middle of the heel, it's going to rub off inside a shoe as the individual's heel striking. So we just tuck it just under the heel there, out the way of that weight-bearing area.
And there's no stretch on this anchor?
There's no stretch on the ankles, that's quite right, Ian. No stretch at the beginning and no stretch at the end. But in the middle, we have the potential to add some stretch, and we can add a little bit of stretch over the Achilles here. I should also just point out, you'll see the foot is in a stretch position through the foot, and the ankle is in that dorsiflex position as well. So the tissues that we're taping are already stretched.
Fantastic. How much stretch are you putting on there?
It's always a difficult question to answer, but I'm going to say somewhere in the region of 50% or moderate stretch. If I have too much stretch, Ian, then the tape is likely to peel off because it's stuck on with too much stretch and it will try to recoil. And if I put too much stretch through, it may start to limit their ankle movement or also irritate the skin. If I don't put enough stretch through, it's not really going to do any harm, but if I have too little stretch, it's not going to stick down properly because it will start to fold and have creases in as well. So you can have too much and too little, but there's definitely a mid-zone to work with. And that tension is there largely to help with the proprioception? We typically find clinically that adding a bit of extra tape stretch in certain places can help improve proprioception and that sensory feedback. Fantastic. Again, being careful you don't overstretch tape, because that's one of the most common causes of skin irritation. So tape stuck down, rubbed over, securely down onto the skin, and that's the first part of the application.
Oh, there's more.
There is.
That's not good. What's the purpose of this bit?
This is a decompression strip.
Decompression? That's a word I hear a lot with these tapes. So what is a decompression strip? What's it doing?
So one of the original theories, and still the existing theories with the tape, is the idea of decompression. And what that's doing is there's a suggestion, or there was initially a suggestion, that the upper layers of the skin, the tension would change as a result of having the elasticated tape placed on the skin. And then as a result, the underlying layers, the subcutaneous layers, would show changes in space. So there'd be an increase in the subcutaneous space. And then the theory is that increase is positive because it can help with fluid flow, it can reduce pressure on sensitive nerve endings, for example, and also it can help with a slide and glide between those different fascial tissue layers. So that's one of the original theories, and that's where the idea of decompression comes from. Now, with a pure decompression tape, we tear the backing tape in the middle, backing paper in the middle, stretch the tape, and then apply the tape with some stretch directly over the most sore area. So we have this idea of decompression, and we can somewhat simulate that, if you will, on a t-shirt. So it's just a good example for me to show this now. If you take a piece of tape and apply it over your t-shirt or top, and if the material is pulled tight and you apply the tape with stretch, you'll notice that the tape then pulls towards the middle and creates these rises, these convolutions in the t-shirt there. So it's not decompression or lifting like this, but it is drawing the tissue in and relaxing the tissue tension around the center of the tape and reducing that subcutaneous space and potentially helping with the physiology underneath. And that's what we feel is going on here with the decompression tapes. That's the theory of decompression. There's other theories of how the tape works as well. I should just highlight that's an important point to make.
And that's really important, because part of our treatment that we discuss is, especially if it's become a nosis, not a nisis, and there's a lot of damage and waste products going on in there, then any improved tissue flow will help just clean the area out and help with the healing process. But Daniel, I've got a really important question for you. Normally this is all aimed at therapists and treating. We also obviously deal with trainers, and is this something that is useful for trainers? Could trainers apply the tape, learn to apply the tape and use it to help people manage their problems whilst they're in the gym?
Yeah, absolutely. A lot of athletic trainers, personal trainers are using tapes themselves, and we have a lot of those types of professionals on our courses as well to learn how to tape. And furthermore, not only can they learn how to tape and do techniques like this for their clients, but they can also teach their clients how to apply this tape themselves as well. So self-taping is an option, and that's something that a lot of people do, but it does pay to have some, to be well taught. So if you've got a client that's self-taping, it's really helpful to teach them how to tape themselves properly and effectively. And if you can tape them and also teach them how to tape, then you've got two things that you can offer them.
Okay, I have one more thing to ask Daniel in relation to plantar fasciitis, and that is, if you've had it for a while, you will inevitably end up favouring the other leg. We've talked again in the video about a lot of problems where you must look after the leg that doesn't have the problem. And if we're favouring the leg, we're going to overuse the glutes, we're going to overuse TFL, we could start getting problems with bursitis, we could start getting problems with runner's knee. So is there any taping you can use in a preventative way? For this example, let's say over the hip, to protect the bursa over the greater trochanter as muscles tighten up through the glutes?
Yeah, absolutely, yeah. So there's two sides to that. I mean, as you say, there's two sides to it. The side that's causing pain and causing compensation, obviously if you can reduce the pain from the pathology on the side, whether it's Achilles or plantar fascia pain, if you can reduce that, then hopefully you can start to reduce the compensation. But if there are issues or potential issues on the other side, you can use the proprioceptive input from the tape to make sure that you're not having a pattern of poor alignment, and also if your rehabilitation is such that you're trying to correct poor alignment or negate it even starting in the first place, then tape can be a very useful tool. For example, you might explain something to patients, you might teach them exercises, you might use your hands to do some tactile cueing to help them with the alignment, and tape is like another way of giving them that feedback, that tactile feedback. I guess it's a bit like following them around with your hands on, giving them alignment advice. The tape gives them that constant sensory feedback.
Great, fantastic. So much more than maybe you imagined that you can do with this tape. So I hope you found that useful. If you want to use this as CPD, have a go at the couple of reflective learning tasks we're about to give you. Don't forget, record them into your CPD logbook. If you don't have one, you can download one for free at our website. So I have a question specifically aimed at trainers. You have a client who comes in who's being treated for plantar fasciitis. The therapist has said that they need to strengthen their foot, especially outside of the treatments. What can you do as a trainer? What equipment do you have available in the gym or maybe at home that could help with that?
And my question is for therapists, and that's what other foot conditions could you use this style of taping for, and how could you change or adjust this taping application to suit different patients?